Hello and welcome to a series of medical information with my esteemed colleague, Dr. Rena Azar, and myself, Dr. Susan Raschal, aka Dr. Seuss. And one of the things that we wanted to do, because we saw a huge deficit in this, is to provide useful medical information so that you can live your best life. What does that mean? It means different things to different people, and we are acutely aware of that. So to do that, we decided that information was going to be key because knowledge is power. And we want to empower you to live your best life, and not just your best life, but your children's, your neighbors, your other loved ones. And so we decided that because we saw such a paucity in that we wanted to be able to share information with you that is credible, that is evidence-based, so that you can make good decisions regarding some of the things that we have to share with you. And you can share that information with your providers, your medical providers.
So we're going to cover a variety of topics in a way that's comprehensive and comprehensible. So you're going to understand more about your body, and that will help you to make good decisions about how you and your provider coordinate to take care of you. Also, we're planning on having patient stories and patient introductions, so we can go have nice conversations and go over histories with patients online. And in addition to that, we're planning on doing a lot of side topics with smaller categories to cover little bits of information that are maybe trivial but applicable in daily life. So look forward to those various series.
We wanted you to know the reasons that brought us together because we practice very similarly. And we also, a couple of things. One is that we really prioritize patient care. And we both we're independent physicians, meaning that we own our own practices. We are not part of a large group of physicians. We're not part of a large corporation. We're not part of a hospital. We certainly utilize those resources, but we are independently owned. The other things that we do have to do with our communications, as well as some of the things that we provide to patients in the office. This was a huge commonality. In fact, we knew how important communication was because Dr. Azar and I, even 2 decades ago, would call each other about patients because we recognize how important it is to be able to have that communication.
To coordinate care and understand the patient through each other's practices. So we both have prioritized that. We prioritize good patient communication, good services, a comfortable, non-judgmental, peaceful environment in the practice and in our communication. And that's something we both realized with each other that we had in common, that we shared. We have also, in addition to that, over 25 years of experience with patient care, both of us, which is a lot of duration of seeing numerous issues, numerous types of patients, and having the blessing of following patient care for a problem with a patient over years.
One of the other things that we share is that we are not afraid of the medical literature. In fact, we embrace it. So we are those docs who will actually review medical literature, analyze it, and integrate that into our practice. But in addition to that, we have stepped out and also used some of the experiences that we have gleaned over our 50 years of experience together with patient care. And we encourage you to also seek that same type of care, if that's what you're interested in. This is the reason why we wanted to share that with you, is because these are some of the commonalities, the things that brought us together. And then when we saw this huge paucity of information that we just assumed other providers or people had heard about from who knows where, we decided that we needed to be able to get the word out to people so that you can make informed decisions involving your life. And also, we want to give you the keys. We want to give you the keys to your best life. And that's exactly why we started these videos.
So here we are. We're just starting them. We've got a large series already made we'll be putting out. And like I said, we're going to share some also smaller stories or smaller pieces of information that are applicable in your life. And we're looking forward to, in the future, to opening up an open forum so people can present questions to us. So looking forward to that. And thank you for your time today.
We'll see you soon.